Un cordial saludo a los miembros de la Comisión Americana de Prevención de Riesgos en el Trabajo. De igual manera para todos los panelistas que intervendrán en el webinar del día de hoy y a todos ustedes que participan y están presentes a través de la red. Lamento no poder acompañarlos de forma real por encontrarme de viaje de trabajo atendiendo algunos compromisos fuera del país con miembros de la Conferencia Interamericana. A la vez, expresarles mis agradecimientos por la organización de este importante evento y reiterar la disposición de apoyo y colaboración del CIESS a este tipo de iniciativas y actividades. Aprovecho también este medio para expresar mi reconocimiento a la presidenta de la comisión, la doctora Graciela Gil Montalvo, quien ha puesto todo el empeño para coordinar y lograr el evento del día de hoy, que tratará sobre la actualización de las listas de enfermedades profesionales y el papel que éstas juegan en los sistemas de seguridad social. Asimismo, saludo a los ilustres ponentes de esta jornada, la doctora Rebeca Velasco Reina, quien nos presentará el caso de México, al doctor Paulo César Andrade, quien nos presentará el caso de Brasil, y al doctor Edgar Velandia Vaca, quien presentará el caso de Colombia, y con quien he tenido oportunidad de compartir por más de 2 décadas compromisos académicos. El evento del día de hoy tiene una particular relevancia para los sistemas de seguridad social de nuestro continente y de manera particular para los de América Latina y el Caribe. Existen antecedentes internacionales sobre la materia, como la recomendación de la Organización Internacional del Trabajo sobre las listas de enfermedades profesionales y el registro y notificación de accidentes de trabajo y enfermedades profesionales, adoptada en la 90ª reunión de la Conferencia Internacional del Trabajo de 2002. La identificación y el reconocimiento de las enfermedades profesionales tiene una relevante finalidad por sus alcances en la prevención. Es importante identificar las enfermedades profesionales relacionadas con el trabajo, puesto que los factores de riesgo subyacentes están vinculados a la naturaleza del trabajo y por tanto pueden prevenirse. La identificación de las enfermedades profesionales promueve la seguridad y la salud en el trabajo y aumenta la conciencia sobre los riesgos a que se está expuesto en el trabajo. Es importante también destacar que a raíz de la pandemia muchos países decidieron incluir de forma expedita el COVID-19 como enfermedad profesional, particularmente en poblaciones trabajadoras expuestas al SARS-CoV-2 como consecuencia de su actividad laboral. Esto nos hace reflexionar sobre la existencia de conexión de causalidad que un cúmulo importante de investigaciones ha demostrado acerca del riesgo por exposición directa o por mecanismos indirectos para ciertas actividades laborales y por consiguiente sobre la salud de esos trabajadores. Cabe destacar que existen poblaciones trabajadoras expuestas a riesgos propios de la actividad laboral y que no necesariamente se encuentran cubiertos por los sistemas de seguridad social, por ejemplo, el de trabajo informal, lo cual nos invita a pensar en mecanismos de protección para este tipo de población, para quienes también constituye un riesgo de enfermedad asociado al trabajo. Reconocemos que el esfuerzo realizado por diversos países en la actualización de las tablas de enfermedades aportan al propósito de la prevención e invitamos a los restantes a adoptar medidas de igual naturaleza. Celebro la iniciativa de la Comisión Americana de Prevención de Riesgos del Trabajo al organizar eventos como el de hoy, que resultan altamente contributivos a la misión del Centro Interamericano de Seguridad Social en materia de formación, investigación y difusión del conocimiento. Un espacio abierto como el que se propone permite, de la mano de reconocidos especialistas, conocer las experiencias y avances de los países en diversos temas concernientes a la seguridad social y constituye una expresión del espíritu que dio lugar a la integración de una comunidad continental de la seguridad social, hoy al amparo de la Conferencia Interamericana de Seguridad Social. Para terminar, augurar el mejor resultado del webinar con la certeza de que las exposiciones, análisis y conclusiones resultarán de provecho y beneficio para la población trabajadora de América, para los empleadores y en general para todas nuestras sociedades empeñadas en la protección de la población mediante acciones efectivas de protección frente a los riesgos del trabajo. Muchas gracias.
Thank you very much, Dr. Emilio Carrasco, for that introduction. Very focused of the topic that we are going to deal with. I greet all the participants, the speaker, Mexican speaker, Colombia and Brazil speakers. We thank your presentation, who's to rescue all this 194 recommendation and to call all the countries to check and update the occupational disease list. I am great that the majority of the ones that are participate are preventionists with a lot of background with preventional disease, and from the standpoint of view of and the technical standpoint of view, and despite all the legal particularities of each country, the majority will recognize the fundamental criteria of occupational disease, mainly when we identify a risk factor at workplaces related directly with a specific word, and because of the exposition of this risk is coherent with the evolution or the story of a disease. For the majority of the countries, the list of occupational disease is the official list of occupational diseases that the social security systems recognize within the context of these social security systems. The checkup and updating of these lists is not only to recognize the benefits, but also we need to propitiate improves notification and register of all these diseases, that the efficacy and preventive actions depend on that, as well as the strengthening of the systems, the surveillance, the health surveillance, the reach and sustainability of social security model systems. On the other hand, and doubtless, we have advanced in prevention of occupational diseases regarding the industrial processes of the organization and new ways of working. The scientific advances in health, in diagnosis, for example, and it is logical. The increase of several diseases associated to risk factors that are emerging or other that are associated to risk factors very specific that not all the countries have recognized, such as cancer or psychosocial diseases or emergence diseases such as COVID-19, recognized in some of our countries as an occupational disease, facing the biological risk associated with health workers, and what that allowed us to. The model that a lot of countries have of an open list that could recognize them as occupational diseases. 2 million dead each year are the world estimation of WHO and ILO regarding occupational diseases, in which this study was made between 2000 and 2016, prior to the COVID. It was made with 19 risk factors, and a lot wonder how would it be widened to if we include other risk factors. Definitely, we are convinced that these findings have been one of the motivation of ILO's motivation regarding safety at work as a principle and as a fundamental right and principle for workers. While as preventionists, we invite you to listen, although in which the framework of the worldwide ILO celebrated last year, he said very emphatically that we know what to do. And of course, we know risk evaluation, promote the access of health systems, workers and unions participation, strengthen that mixed committees, guide workers in its right to deny themselves to work in dangerous works and demand that these diseases are recognized. Going back to ILO and recalling that it was in 2010 when ILO called to build this list, there are other countries that they have had the initiative to keep this practice, but the American Commission on Occupational Risk have want to call and make emphasis to update and promote to check this list of occupational diseases. It is important as well that in the framework on the health surveillance of the workers, we have to be very conscious. We have to consider those psychosocial risk factors that the majority of the list does not consider. And of course, we have the ergonomic and other traditional diseases. But before finishing my little speech, I wish that this webinar is success. I'm not going to take much more time to our speakers that because they have experience to share with us precisely the right of this checkup of this list or framework of occupational disease for us. We are pleased to present the first speaker, Doctora Rebeca Velasco Reina. She's a surgeon specialist in occupational disease, MA in social and occupational disease, head of the Mexican Institute of Social Security, certified by the National Council of Medicine at work, professor at the public health at the National Autonomous University of Mexico, professor of the health at work diplomate of the subdivision at she's participant in the board of directors of National Council of in 2014-2018, signed in different stages of certification process. Since 2010, she has a wide experience in various activities of continuing medical education and occupational health in national and international forums. I thank her, and I give you the floor, Doctor. Thank you very much, Doctora Graciela Gil. Good day to everyone. I will share my screen with you. So I am going to share Mexican experience regarding the occupational diseases. What do we do to identify them, to recognize them? And of course, this exercise that we've done with the Ministry of Labor and other ministers, and as well as accompanied with union leaders to update this occupational disease list. Quickly, we will see the general information of what IMSS is, the definition of occupational diseases within the context of social securities, which are the consequences of occupational diseases, the list, and as Doctora Graciela Gil was saying, the challenges that we face. Mexican Institute of Social Security have more than 1 million companies affiliated in 2022 and more than 20 million workers the health services are around 600 and 1,144 physicians at work. So going to the definition of occupational disease is contemplated in federal law of work and social security law. And so occupational disease is any pathological state derived of a continuing action that has its origin or motive within its work. It's the Article 475 and as well as the 43 article of Social Security law. The inclusion and exclusion criteria, there is a protocol that is done by physicians to identify whether the health damage that the worker is associated with risk factors that can be exposed in its work or the environment. So I'm not going to stop that much. I'm just going to state that the criteria are established already. In exclusion criteria, the main one is that at the moment of having this evaluation, the work law marks this exclusion criteria. There are two occupational risks, which are the accidents, and the second one are the diseases. Which are the consequences of occupational diseases that are also shared with accidents? The first one is a temporary disability, that the people cannot go to its work as a temporary way because its physical condition that does not allow it. Afterwards, it may have a sequel. This person can have a sequel. So this is identified as a partial permanent disability. And as a consequence of this, occupational disease cannot do any work for the rest of their lives, and that is identified as a total permanent disability. And of course, the worst of the consequences is death. These partial and total disabilities, as well as death, are very important to tell them, because later on, when I am referring to the statistics, I will state them. So we recognize them as occupational disease, and we will see what are the consequences. So I'm going to show you here the national tendency of from 1976 to 1999. The data that we have of 2022 are preliminary. They are approximately 35,699 occupational diseases. As you can see in the graphic, an important peak because of COVID-19, because in Mexico we did recognize COVID-19 as an occupational disease. We have different action to promote and to check that there wouldn't be any subregister of occupational disease. It is something complicated to qualify this illness because the patient does not suspect that they may have this illness associated to work. Nevertheless, the company, but so for the National Health Coordination, we have made a lot of efforts to sensibilize whether the workers, the companies, and the doctors, or on which are the health damage that may be generated by the work, so we can elaborate this research protocol, and it can be recognized as occupational diseases. In this graphic, I show you what is the occupational disease rate by number of workers. These data are preliminary. Which are the main occupational diseases diagnosed in 2022? We keep COVID-19 as a first place. The musculoskeletal issues are the most recognized. On the contrary, we have dorsopathies with 8.5%, carpal tunnel syndrome. So as you can see, this musculoskeletal part is very important. We also have pneumoconiosis and hypoacusis. On Social Security, through its official webpage, it is published openly the statistical memory of work, so you can find there and identify if you are interested in other years of how the behavior have been regarding occupational disease. As we saw in previous from this 35,699. So we are going to talk on consequences. Which of these cases have sequels? The permanent disease rate in initial cases in 2022 is of 0.4, and the main diagnosis of these sequels of this illness are hypoacusis, pneumoconiosis, shoulder lesions, carpal tunnel syndrome, and other kind of health damages. We had, unfortunately, deaths for occupational diseases. That is, the rate is 4.19 approximately for 2022. And the main death causes, the COVID-19 is still the first place. So even though there are other regarding the occupational disease list, they are published in the federal law, work law. The last modification was in 1970. We have a great effort in Mexico through the Ministry of Labor to make these groups of experts to make a proposition and have an updated. This list is in the Article 513. Generally, these are the list. And in updating, the objective was that the list would be more complete and could be identify diseases that we didn't have, that we couldn't contemplate before, and to add clinical elements to diagnose occupational diseases, and as well to be more objective and to widen occupational diseases that could be recognized. The updated include new diseases related with work that previously we didn't have it, such as heart attacks, biochemical exposition, endometriosis, COVID-19, among others. And it also indicates the exposition in the project law. This new list will increment from 161 to 194. The illness that were recognized were grouped. This is an example of the updating. So it's associated with a code. It mentioned what kind of workers could be, or the work position that could have this kind of illness, the kind of exposition that could be associated, which are, well, before this. I would like to recognize a conjoint work that it was done in Mexico, headed by Ministry of Labor. They participated specialists, physicians, of IMSS physicians, ISTE physician, Ministry of Health, and as well representative of unions of employees. We are glad that this work group that they were done, approximately more than 80% of the professionals that participated were from Mexican Institute of Social Security. And well, it is a work that we hope to see consolidated. So now the challenges that we have in Mexico, we still have the ability to identify them adequately, these health damages. We have the psychosocial risk that can generate not only mentally, but cardiovascular, among other risks. So we are also working in this issue in order to give more information to the staff and work at health that so we can identify these health damages. As well, the new modalities, insurance modalities, working from home, and other kind of insurances that Mexican Institute of Social Security are being given. We are very glad that these people can have the Social Security part, and as well, we are adequating which are going to be the criteria for the qualification of these cases. The objective is to keep improving the detection, qualification, register of all the occupational diseases as a occupational health policies. And this would lead that each year less workers are left without receiving the benefits. Also to contribute to the prevention of occupational diseases and to help the financing balance of IMSS. Because we are also working in priority actions to give all the companies information to prevent work accidents and occupational diseases. This is focused to prevent musculoskeletal diseases. Also, to the health surveillance, we realized with COVID-19 that we don't pay that much attention of the relevance that the workers may be healthy. And when we see that there were health commissions that could be more susceptible or having complications by COVID-19, we start putting our emphasis on that, so the workers can have good health conditions. And the fourth guideline, ELSA condition, and supports companies so they can implement these some measures to avoid occupational diseases with these risk factors. In this part of prevention, the finance balance is very important, not only from Social Security, but of the companies, the businessmen, the employees have to understand that it is important to invest to avoid occupational diseases, as well as the workers have to have conscience to do these actions, so they keep themselves healthy and they will help themselves in quality life and economical issues. It's better to prevent than to attend the risk. We are going to reinforce by the coordination of occupational health at work with these new modalities or this new kind of work, and with the ones that we have already. You saw clearly in the statistic that I showed, we have to focus on musculoskeletal issues, but also one of the preventive issues that we are doing. We have 4 labs of work and health that supports companies in environmental monitoring. This is completely preventive, so the companies may have information on how its work environment could be to avoid damage in the health of the workers. So we are going to work in that. So that will be all for my part. I am here if you have any doubt or any comment. Thank you very much, Dr. Rebecca. For all the participants, we want to inform you that you can make your questions in the question and answer box, and we're going to read them after all this, the panelists. We are going to give the floor to Dr. Paulo César Andrade, who is going to share Brazilian experience. Dr. Paulo César Andrade, he's fiscal auditor of the Federal Revenue Service of Brazil, acting in the Ministry of Social Well-being. He is also the coordinator of disability benefits and professional rehabilitation. He graduated in dentistry at the University of Brasilia. He has a qualification in occupational safety and health from ILO. He's a specialist in health sciences, health surveillance, and a specialist in prevention and protection of occupational risk at the Ibero-American Social Security Organization. And he holds a master's degree in health sciences, occupational health from the University of Brasilia. Welcome, Dr. Paulo. Thank you very much for being with us. I give you the floor. Thank you very much, Doctora Graciela. Thank you very much for the opportunity of participating in this webinar. Of course, I apologize myself because I'm not a Spanish speaker, but I prepare my presentation in Spanish. So I'm going to try to do it the best way possible. Could you listen to me? Thank you very much. I saw the need of adding a lot of information in my presentation in order to try to give the information in a more easy way. So the concepts of occupational diseases, the legal definitions, are different in the different countries, including from within the same country. In Brazil, for example, we have different concepts within the Ministry of Social Prevention and within the Health Minister and within the university. So we have different concepts, but the concept of occupational disease within the context of Social Security, it is in the Social Security Benefits Law. We have two concepts. The occupational disease, understood as that produced or triggered by the exercise of a specific work to a certain activity, and included in the respective list prepared by the Ministry of Labor and Social Welfare. And the occupational disease professional, thus understood as that acquired or triggered by the special condition in which the work is performed and directly related to it, included in the list referred in the first part. Professional diseases, work is a determining cause of the development of the disease. And the occupational disease, work is a contributing cause for the development of the disease. Occupational diseases and professional diseases are included in an official list. That is a list of work-related diseases. It's not a new list. It is elaborated by a health minister in 1999. So Social Security is use this list that was done in 1999. This list of work-related illness is not an exhaustive and nor a closed list. It is just an open list. So We have the groups of contact diseases in the list of occupational disease list, but they are very wide groups: infection and parasitic diseases, neoplasms, mental disorders, mental and behavioral disorders, which is a great challenge of the recognition of these mental disorders as a occupational disease. But we have them here. All the lists that are in the list. How is structured this list? We have two lists. It's just a very wide didactic organization. List A, in which it is part of occupational agents or risk factor related to the etiology of occupational diseases and other occupational diseases. So you start the start point of B is agents or risk factor to the diseases, and B list is another way. You start from the diseases and you go to the risk factor. It's just a didactic division. So in Brazil, the list of occupational diseases is divided in these two lists, A and B. So this is the structure of the A list. We have here, for example, arsenic is related with different illness, such as a problem with the liver, with the lungs, etc. So this is how the A list is structured. And here we have B list structure. For example, or mental disorders, mental and behavioral disorders due to use of alcohol, related with problems of employment or unemployment, or circumstances relative to work conditions. We have only a small example. The list is very wide. I just put some examples. But what happened? Both lists were not enough to recognize all the occupational diseases. These both lists made by health minister. So Social Security would need to widen the possibility of recognize other diseases because the sub-register was very high. So Social Security make an epidemiological research to create a new list, and a C list, in which it was an analytical study, a cohort study, a prospective study, which it started by the economical activity, by the worker, and the development of accident or illness. As a historical populational study that used all insured persons of the National Institute of Social Security, and it was separated in subgroups: exposed and not exposed, incidence measurement, and establishment of risk estimators, relative risk, attributable risk, and unified benefit system. This C list, it's important to highlight, is not an integral part of a list of occupational diseases, but it is used by the National Institute of Social Security to establish the causal or contributory nexus of work for the development or aggravation of the disease. The list was implemented on April 2007. Here we have the structure of CIESS. There was a need to make a law. So we added a new article in Social Security law that established that the medical expert of the National Institute of Social Security shall consider the disability as work-related. It's incapacity as work-related when it is proven that there is a technical epidemiological link between the work and the injury, resulting from the relationship between the activity of the company or the domestic employee and the morbid entity causing the disability listed in the International Classification of Diseases. So this is the structure of CIESS. We have here an international interval, and here the classification of economical activities. So when the beneficiary of the National Institute of Social Security is disabled for work, the medical expert needs to establish the origin of its disability, whether it's a common disability or a work-related disability. And adding to this, we must use A, B, and C list. The C list suggests a presumption relating a causal between the work and the injury. And the medical expert have to confirm this relationship, causal relationship. So we have here an example. An economic activities epidemiological related to the development or aggravation of diseases classified. For example, we have economical activities, in which it is suggested that the development of these disorders have as cause the work of a determining or main cause or contributive cause to the disorders. For example, for neurotic disorder, stress-related disorder, and somatoform disorders, for example, collective transport, multiple banks with commercial portfolio, saving banks, public administration in general, hospital care activities. So there is an epidemiological highlight. Each case, the specialist is going to confirm or not this relationship. Here we have some data of accidents and occupational diseases in Brazil between 2019 and 2021. Here in gray, it's a total number. So exclusive workers insured at the National Institute of Social Security, except independent workers, because they in Brazil, independent workers, they do not have Social Security coverage, because so they're not considered in this list. They're not considered data of accidents and illnesses of public officers, militaries, and informal workers. So So this in gray, we have the general numbers. In orange, we have the notification made by this accident and occupational diseases communications is the register of accidents and occupational diseases by the notification system used by employees and for society, unions, for example. So in general are the notifications done by the employees. And in pink, we have the notification made directly for the National Institute of Social Security. This register of accident and occupational disease by evaluation and of this disability for work by National Institute of Social Security only accidents and occupational diseases with work disability up to 15 days have benefits. In Brazil, these benefits is a payment of 15 days of disability. The first days, the employer must pay them. So here, if the beneficiary have more than 15 days and is going to receive a benefit, the same, without the communication by the employer, the medical expert of the National Security of Social Security can notify and register disability as an occupational origin. In blue, you have occupational diseases notified by the employees are very low, very small amount of numbers. To 2020, 2021 is an exception because COVID-19. So in 2019, work-related diseases notified by employees are 10,000. Can you see the difference? The institute notify the 99,000 work-related diseases. We have the same number. COVID-19 had a strong impact on work processes, on the number of active workers, and consequently on the occurrence of occupational diseases and accidents, had also an impact on the registration processes of occupational accidents and diseases. So here in 2020, there was a decrease in the number of accidents, but the peculiarity is that we see a rise in occupational diseases by consequence of COVID-19. So this is practically the same information. In this part, I have the decrease of register of typical traumatic and tragic in itinere occupational accidents in the year 2020 due to the COVID-19 pandemic. There was a growth of records in 2021 in relation to 2020, but at lower values than in 2019. There was a strong growth of occupational diseases records in 2020, mainly due to COVID-19. Of the 33,575 records of occupational diseases in 2020, 22,309 were from COVID-19. So here the register of COVID-19 as occupational disease in 2020. We highlight here the infection due to COVID-19. Here we have the relative information. The behavior is the same. COVID-19 impacted in the increase of occupational diseases, as well as impacted in the decrease of accidents in general. Here we have information of cash benefits. As I said, in Brazil, the cash benefits is paid by the National Institute of Social Security after the 15th day of incapacity for the worker. The remuneration for the first 15 days of work disability is paid by the employer. In 2019, from the 586,857 occupational accidents and diseases recorded, 33% were converted into benefits, into cash benefits, because the others impacted disability up to 15 days. So I would like to highlight this chart. The causes of the benefits due to temporary disability of common origin. This first chart, it's a common origin versus the accidental origin or occupational accident. You can see that the costs are the same and the amount is different. Accidents, work accidents, but the ranking of the causes of this International Occupational Diseases classification is the same for a common origin or an occupational accidents. In Brazil, mental disorders and behavioral mental disorders are the third cause, considering the international classification of occupational diseases. The third cause of temporary disability related of occupational accident. So this position here, it's due mainly to the appliance of CIESS. Because prior to 2007, this chapter wouldn't be here. It would be very low. And now we understand the importance of the recognition of mental disorders held by CIESS. Here, if we consider a division of international classification of occupational diseases, as you can see, the 20 causes, the 20 more common causes, we can see that mental disorders are here among the 20th. The fractures are the main one. But you have also very important musculoskeletal so it is the important challenges that we have to update the list of work-related diseases. We share the same problems of a lot of countries that we have that we do not have updated lists. Of course, the lists are open, but there is a need to update to bring more safety in the work. To update the list of technical epidemiological nexus, so it's a list C, that was celebrated 2007 to fight and reduce the high underreporting of occupational related illnesses, train public and private agents to recognize work-related diseases, and effectively consider these occupational diseases data in public policies on occupational safety and work. Thank you very much. And I am here. Thank you very much. Thank you very much, Dr. Paulo. Excellent. Your Spanish is very good. We have understood everything. Next, we are pleased to give the floor to Dr. Edgar Velandia Vaca, who will share us a Colombian experience. He is a surgeon from the National University of Colombia. He's a specialist on occupational medicine and a specialist in occupational health administration. He holds a master's in educational from Javeriana University and a master's in direction and management of social security systems. He is the chief physician of Room 1 of the National Board of Disability Rating. He was also Deputy Director of Occupational Risk of the Technical Chamber of Occupational Risk of the Federation of Colombian Insurance, FASECOLDA, for more than 16 years, coordinating technical and operational issues of interest to the Union for the Occupational Risk Administration. He served as well as coordinator of the National Disability Rating Network and has been a consultant for the World Bank. He participated in disability rating systems and table of occupational diseases and in the team that designed and elaborated the disability qualification manuals of governments of Colombia. He was member of the commission for the drafting of the technical standard of safety and health at work of the Ministry of Social Protection. He has been an expert on issues of definition of total and permanent disability, lecturer at various events at the national and international level. His teacher and instruction of occupational medicine, occupational safety and health at work, and social security in several universities. Welcome, Dr. Velandia. Thank you very much for supporting us, and I will give you the floor. Thank you very much, Dr. Graciela. We have an advantage and a disadvantage. An advantage is that I listened to my predecessor, but then disadvantage that I can left out of topic, but we are going to share a little bit so I always start with a phrase of Bernardino Ramazzini book, De Morbis Artificum Diatriba, as a preamble of what it means, health and prevention at work. In our country, as surely in the majority of the country, we have a technical definition and a legal definition. A technical definition that is universal from the academic standpoint of view, and there are a lot of definitions. I have some of these, the WHO definition as well as the ILO definition. And each country in its constitution has adopted a definition. Our past law adopted a definition of what is occupational diseases. We pass from occupational diseases, and in this law, we changed to occupational diseases. Classically, we have we gather the ILO definition that it's an illness resulted as the exposition of any risk factor related to work or the environment in which he has worked. A very similar definition that Mexico has in its legislation. But also, we defined as occupational disease that is in the occupational disease list, and also can be considered those diseases that are not in the table but can be demonstrated a causal relationship with occupational risk factors. So we have a mixed list, close in the sense that only the pathologies that are in this list will be considered, but the norms gives the opportunity that if you prove that any disease that is not in the table can be considered as occupational disease with causality studies. The problem of occupational disease is a worldwide problematical. WHO has mentioned this in the work is not a report nor diagnose occupational disease, and ILO states consider as cause the abscess and the possibility of its existence, a lack of diagnosis. Occupational disease. I'm going to pass this very quickly. Occupational disease is slow start. It's not non-violent. It requires a repetitive and progressive exposition. The majority of the times it's irreversible. Its etiology is known. This is important because if we know the etiology, we have an important engagement in recognizing and identifying them. The majority of the time, we can prevent it if we can recognize it on time. That is why our commitment as prevention is to control it. Why to differentiate origin? I bring here why we have to recognize why the disease is occupational disease and not a common disease. The main one is prevention, undoubtedly. Unfortunately, the majority of the countries they recognize so has been one of the main issues that led to organize this occupational disease list. But mainly, the early detection is very important. ILO states within the definition of occupational disease have two elements. The causal relationship between the exposition of a work environment and the acquired a risk factor and an effect it's needed. That is the cause. So the cause, which would be the risk factor, the consequence which would be the health effect, and a causal relationship that can be demonstrated. And so we can recognize the illness as an occupational disease. So why this list is useful and why can we study this causal relationship between a risk factor and an effect will let us to state which illnesses we are going to put on the table. It's a scientific study that of applied epidemiology, and there are a lot of causal models. I just named some of them: the determinist model, the multi-causal model. There are a lot of models. We have the Bradford-Hill criteria, only to say that we have different methodologies to determine that causality. At the end, what we look to determine whether there is or not this causal relationship between this risk factor and that illness as an effect. So we have here the list of occupational diseases. What must a list must include? Those that we have evidence of a causal relationship between the risk factor and the illness. So experts such as ILO and European Commission gather themselves to see whether the evidence has led to state that there is indeed a causal relationship between a risk factor and the diseases. So they are those that has demonstrated with evidence that has a causal relationship with a specific risk factor and an illness. The causal relationship is demonstrated. In closed lists means that only the illnesses that are there are clearly proved as occupational diseases. So what do we use this occupational disease list? So the reference is ILO's list, checked up, updated in 2010, and it is a recommendation of an ILO recommendation. So it means that each country can take the totality or partially diseases of that list. And what do we look? What is the objective? Is to have preventive measurements to reduce morbidity rates, to sensibilize health staff to improve the knowledge and diagnosis of those illnesses, to promote the research of those illnesses. And that's not a problem only in Colombia, but there are a lot of methodologies, but we don't have a clear methodology to look and identify this occupational disease, and to state some criteria for the recognition of each occupational diseases. Not of a causality. The causality is already proved. Criteria to recognize that indeed in a specific case, there are enough risk to recognize as a occupational disease in that specific patient. So we have 3 systems that ILO also recognized: the closed lists, in which we have causal agents, risk factors, exposition conditions, and the occupational diseases. It is limited. It is recommended that has recognizable criteria to define the risk factor. The majority of the list does not have it. Perhaps the best list in this sense is the European list. And leaves out those that are not there. An open system, a global coverage in which any illness can be recognized as occupational disease only when it can prove this cause-effect relationship. A mixed list have a occupational diseases list, a general definition. And finally, the diseases that would be included in the list, the causality is already proven. We don't have to establish that the noise produces hypoacusia. We don't. What we have to recognize that the exposition is enough, that whether for the time of exposition, for the doses, so a specific patient would have acquired that illness. The diseases that are not included in the list are not recognized, and of course depends in the legislation of each country, but in which the closed system list, if there is an extra one, we should have to establish all the research. In Colombian case, have two rules: the occupational list of 2014 and the 2020 decree that recognized COVID-19 as an occupational disease. Colombia, for the agreement 1477, adopt ILO recommendation and occupational list of Brazil of 1999. Our list model is that of Brazil, which is recognized 15 illness groups, 381 occupational diseases, and to this list is incorporated some of the ILO recommendations, some illnesses that are also recommended by European community, and a third group, which is the occupational industries, where this risk factor can be done. And a new concept that some countries have, and is a concept of direct occupational disease. As Brazil's list, we have two lists: risk agents to facilitate the prevention of illnesses and to determine the diagnosis. And we have the determination of causality to determine the relationship, the cause-effect relationship, and should identify according time, environment, context, and place. We will have analysis and environmental analysis to determine whether the risk factor is enough or not. And it is established that the worker can bring proofs if he considers pertinent. The diagnosis of the illness So in the first section, where the etiological agents or occupational risk factors are, and in the section 2, we have the counterpart, which is the illnesses to determine by the medical diagnosis, which is the Brazilian list, which is different in the second section. We have direct occupational diseases, and the second part, we have diseases classified by group, which are not considered directly. In the first section, we have the risk factors to have into consideration: chemical, physical, biological, psychosocial, and ergonomic agents. Each of these subdivisions has its own list related with a disease. For example, we have an etiological agents. In this case, so we have the illnesses, which are the illnesses associated to that risk factor. And in the center would be the industries and the works. This is a non-exhaustive list, so it gives opportunity that other economical activities, if it is proven that they use this, may be recognized as well in this list. The second section, where you can see the diseases, the B part, so it's a counterpart of section 1. Those illnesses that are not considered directly, we have 15 categories, from parasitary infections, cancer, etc. Each of these have its own list. And here it's an example. So we have the illness, the code, the risk factor, and which are the economic activities. So it's more or less the same list as the section 1, but in this case, you can see it from starting from the illness. And the second section to determine the direct occupational diseases. We have 4 main diseases. We have all pneumoconiosis and the malign mesothelioma, asbestosis, silicosis, and a 4th mesothelioma, evil mesothelioma. Why direct occupational disease? The economical and benefits to occupational disease, or direct occupational diseases for those workers that present any of these illnesses that I mentioned. If these 4 illnesses, it would be recognized benefits, working and economical benefits in a direct way. If I prove that a worker has asbestosis, for example, and that it is working in any of industry that within its process so in this case, they will cover directly and with any process this is disease. So the important thing would be that the patient would have asbestosis, and that directly this worker works directly with asbestos. The 670 decree. Colombia was one of the first countries that recognized COVID-19 as an occupational disease, a direct occupational disease. So you didn't have any process of qualification. So if you were a worker of health sector, not only the physician or the nurses, but all the administrative surveillance and support staff, which of the risk situation is so any workers of health sector that would be, for example, in a hospital, that situation could work in the services is direct attention. For example, all the cleaning staff was also at risk directly and recognized as an direct occupational disease. The benefits, and it is recognized from its diagnosis moment. So our list, finally, we have 5 instead of 4. And the 5th one would be COVID-19 as a health staff sector. And it was included in the 675 decree in 2020 that were attending COVID-19 patients. And these are the 2 diseases that were included. COVID-19 identified and suspect virus. So what was the result? That all the countries that recognize COVID as an occupational disease, the rate increased from 78.6 in 2019 up to 500.6 in 2020. So finally, what we have is some direct and non-direct diseases. The non-direct, the causality is proven. We have to verify that indeed the worker has a diagnosis and the economical activity correspond to the risk factor associated to the disease. So what I am going to prove is that the exposure was enough. And the direct occupational diseases, I just have to prove that the illness is there and that the worker was exposed at that risk factor. It is not necessary a study that proved that the exposition would be enough. Okay? The last, so I'm going to close with this. A quote from Bernardino Ramazzini. He reminds us that when we does not diagnose the illness, it's because we lack of previous exam. Thank you, Dr. Belania. Excellent speech. We congratulate to all the speakers. Before giving the floor, the question and answer session that Dr. Garcia have already organized, I would like to make some statements derived from your interventions. For example, they need to do studies or research, epidemiological research. The second one, that it's very clear we must update and check this occupational diseases list, and that this updated, there is not a unique formula. We have seen that today that indeed we have psychosocial risk factors and cancer factor, that each country marks legally its occupational diseases list by socio-economical reasons. That also it is true that a lot of our countries, we lack a link between the prevention services with health sector to follow up and identify and report adequately all the occupational diseases. I leave this to generate more questioning from our audience, and let's go to the question and answer session. I give the floor to Dr. Javier Garcia. Thank you very much, Doctora. Before we congratulate, we thank all the people, all the audience that has gave all the questions. I congratulate as well as the speakers for the sharing of all the things that you have said, and a special recognizing for Dr. Paulo for giving this presentation in Spanish. They are asking us the presentation of our speakers. So without compromising our speakers, we would share the presentations by the web page of the American Commission on Occupational Risk Prevention. I will give you the link at the chat box, and if I may share the microsite, once you enter the link, you will see this. So we're here with the webinar, and if you go to webinar, you could there, once the event is finished, you could see the video of that we have today, and in that section, you could see the presentation of all the speakers once we have the authorization to share them. So you go to this webinar section. So I'm going to start with the questions of the audience. The first question, I believe that has already been answered during the three intervention spots. Anyway, I leave it here so you can add anything else. How can we differentiate a normal disease or an occupational disease? For example, some question to Dr. Rebecca. Does IMSS have guidelines to the determination of occupational diseases? And second question is, in IMSS case, wouldn't be better not to have a closed list regarding occupational disease by the difficulty of updating, but perhaps to have some parameters to determine what is an occupational disease or a common illness? So I give you the floor, Doctora. Thank you very much. Regarding whether would be better not to have a list, the list in Mexico is mixed. You can have the list, and those who are not in the list, but at the moment of researching, there is an association between risk factor that the worker is exposed and in the workplace. So this list is not limitative. If there is any other illnesses, we can recognize it. We have at IMSS a procedure to the determination of occupational disease, and we also have the medical residents. So we invite all the physicians that are seeing us today and that are interested in occupational medicines could make their exam. So you can be a specialist in occupational diseases. There are centers all around the country, and the majority of the preventionist physicians are from the institute. And this, what can we see clinically? Our topic is going to be the same. The difference, which is the origin of an occupational disease or a normal disease or common disease. What we have to do is to identify where were the exposition, as well as other pathology that can be related to the work. So we invite you to make the specialty at IMSS, and it's a very wide and interesting topic. It's 3 topic. So we have also added the environmental risk factor. That would be my participation. Excellent. Thank you very much. I don't know whether Dr. Andrade or Dr. Andrade would like to add something. On how to differentiate occupational disease from a common disease. Particularly in Brazil, the medical team of the National Institute of Social Security has the list, A, B, and C lists, and and 2 years ago, the companies are obliged to send each month information regarding the occupational exhibition of all their workers, exposition, by a system called CIESS. The companies is forced to inform whether the worker is exposed or not, which kind of exposition, which are the risk factors, the exposition limits, the use of all the protection equipment. So we are starting this process only a year ago, but we believe that this information that the physician has during the evaluation of the disability will contribute a lot to determine whether the disease is or not occupational. The physician need the information that comes from the worker. Thank you very much, doctor. I would like to add only, totally agree with my colleagues. I would add that we have to deepen into the research, because it's a topic that we still need to develop a lot. We have methodologies, but we do not have a specific methodology, and the countries we haven't adopted a specific methodology. Somehow it could be easier to determine these illnesses that have a single cause of risk factor, and that is a very obvious one. But when the diseases are multicausal, such as musculoskeletal diseases, for example, or psychosocial diseases, the topic is more difficult. What we did in Colombia with psychosocial diseases, it was established a protocol, a diagnosed protocol was established, in which it defines more or less in intra and extra work risk factors facing this exposition risk. So after this test, we will be able to consider whether disease is not an occupational disease. So sometimes it's very difficult to determine where is the limit between the work and non-work risk factor. ILO states that when in a worker population that disease behaves with much more frequency and presence than in the same population outside the work. So that is another aspect that could give us a determinant of occupational disease. Excellent. Thank you very much, doctor. Actually, this answer that you give us answers to the past of questions. It asks whether work stress can be considered a mental disorder and could be triggered by a work environment. And you were saying this. I don't know if you would like to add something else. Stress associated to work is very complex because it has multi-factors. But let's say that in our table, it was centered basically in some diseases that could be related with work, basically much more clear than others. Depressive anxious disorders, for example, and other kind of factors. Because sometimes we confuse social cycle this topic of Dr. Velasco, please. Thank you very much. Only to say that in Mexican case, it is contemplated mental disorder and cardiovascular diseases associated with occupational environment. So regarding the question that they are doing here of labor harassment in Mexican case is a risk factor. What we qualify would be the consequences, the illness, and depressive disorder, etc., anxiety disorder. We would have the research that a physician would do to identify this cause between the work environment and the health issues that the worker would have. Thank you very much, Doctora. Actually, they were sharing the Costa Rican case. They were saying that in this case in Costa Rica, there was a people in which proven research, the harassment may be proven. And I believe that it's something similar that Dr. Velandia was sharing. Thank you very much. Indeed. Harassment in Colombia has a legal connotation, and the typification is done by a judge, no one else, only a judge. Thank you very much, doctor. So I go to the next question. We have two more. The first one is, which is the impact of diseases, for example, in beauty parlors or in contact with poisonous animals or intoxication diseases by exposition to biohazard diseases? The answer, we could have another webinar, but the impact of occupational diseases is on the health of the worker. There are economical losses to the company and as well to the Institute of Social Security, because there is given an economical benefits for the disability days and sequels for the medical attention in the case they require treatment, surgery, etc. The impact is very wide, and we can tackle in life quality in a lot of standpoint of it, but these are interesting topics. In Mexico, we do recognize them, whether we have or once the worker suspects or identify that it may be generated by the work and gather this medical, technical, legal part, we can recognize them. Thank you very much, doctor. And regarding what Dr. Velasco was saying, we remind the audience that at the end of this webinar, it will appear a QR code, so you can qualify the quality of this webinar, and then to invite you. So what future topics you would like to tackle in this kind of events? If the invitation for this survey is going to be also shared by email. So the next question is, what happened when at COVID pandemic, the people went to telework, and later on, 1 or 2 years on, they claim occupational disease, such as carpal tunnel? Would that could be considered occupational disease, even though when there was not any norm for telework? I believe that this topic of recognizal of a disease, when it is known the work environment, it is already very difficult. And telework, it's very difficult where we don't know the specific work environment. It's much more complicated. I believe that one of the biggest challenges in this new work modality, such as telework, is to recognize the work environment adequately that we don't know. Thank you very much. Besides, Dr. Velandia remind a specific characteristic of occupational diseases, which is chronic. They are going to research whether this same activity that was doing and what time of exposure to develop this professional disease. So it is important that the criteria are gathered. Dr. Velandia called the Braden-Till criteria. The fact of doing a work from home only for the time of pandemic, we should have a retroactive research, and it should be coherent with the diagnosis. Thank you very much, Dr. Velasco. Please. For Mexican part, we check the kind of illness, the time of exposure, the activities, and for these new modalities, which was what we saw in this modality, the people that are hired to work at home, and from which, at least in IMSS, we work the criteria to see whether they would have or not work accidents. Thank you very much, Doctora. To close this activity, Dr. Graciela, I'm going to leave you a question. But if you, I share this microsite that I was saying. Once you go to the webinar section, you're going to see here, and you can see the speakers and the presentations. You can have here the presentation in English and in Spanish. And in some sections, for example, when the speakers have shared with us the presentation, you can download it from here. So wait a little bit, and they are going to upload this presentation. So, Doctora, I leave you this question. In this case, for Doctora Graciela, which are the elements so the professional disease catalog may be very small in Dominican Republic case comparing Mexico, for example? Well, our occupational disease list, it's an open list. It has a lot of years. We need to update it. And presently now we are trying to concentrate to update this list. And we think to include not only the factors of social security system, but all the specialized societies regarding prevention, occupational medicine, and other players, stakeholders. So it's not that it's short, it's that it's not longer updated, and it needs to be updated. We remind you that within the framework of Social Security, the occupational risk factor that started in 2004, and that list of occupational diseases was done a very close one. So it's time now to do updated. So this helps us a lot because we see already all the things that we have to tackle. And besides, and to close this activity, I would like to tell you that this specific topic, the time is not enough to deal with it, because along with occupational diseases and all the lists we haven't tackled the protocol issues. What happened with pre-existing diseases, or whether if I change of work, how does social security acts. So we have a lot of things to talk still about, and all of this requires a lot of time. We could I remember that when we were talking of this topic, let's not deal with health surveillance, because it's another topic for a webinar. But regarding what ILO mandates to, and that are following them, because we agree that with the strengthening of this same health surveillance supports precisely social security at work as a fundamental principle of all work. So I would like to live with this, and formally, I believe, to say goodbye, to thank all the audience. Thank you very much for being with us today. It has been very important, and we hope you follow us not only in the macro side but social media. But our emails are open to answer personally each question that you have. The speakers and I, we are at your disposal, and we wait for you at the next webinar. Thank you very much.
Muchas gracias, felicidades.